This session is all about increasing accessibility, affordability, and improving outcomes for healthcare transformation. And for that, we have leaders from the hospital ecosystem of the country here with us. Let me invite Dr. Deepak Patkar, Director, Medical Services and Head Department of Imaging, Nanavati Max Super Speciality Hospital. Dr. Deepak, we welcome you, sir. We have with us Mr. Muktesh, Narula, Associate Director of Pinnacle Teleservices Private Limited. If you can come on stage, please. A huge round of applause for him. We have with us Dr. Kunal Punamiya, CEO, SL Raheja Hospital of Fortis Associate. Dr. Kunal, if you can come on stage, please. We have with us Dr. Niraj Uttamani, Medical Superintendent, Lilavati Hospital and Research Center. We have with us Dr. Sandeep Gore, Director, Emergency Medicine, Fortis Hospital, Mulund. We have with us Dr. Shreekant Sapatnekar, Medical Director, Godrej Memorial Hospital. And we have with us Dr. Albin Sigamani, Chief Scientific Officer of Newman Health. I think everybody is here. I think Dr. Albin Sigamani is missing. Is he here? I think he was here. If he can, I'll ask my colleague Neha to speak to Dr. Albin Sigamani. If he can join us on stage, please. So hi and welcome all to a very prestigious session, and I'm sure the insights which we'll be getting out of this session will be helpful for all of us to move into the right direction, because the ideas, the insights we'll get from the leaders of the hospital ecosystem of this part of the country will definitely help us. So let me start with Dr. Deepak Patkar. Dr. Patkar, accessibility of quality healthcare and providing a quality, sustainable ecosystem have often proved counterproductive. How are hospitals looking at improving accessibility and affordability while remaining sustainable at the same time? I think it's a two-edged sword kind of a question, but if you can put some light on that, please.
These are exactly opposite things, and to get them together is a big challenge. And all of us sitting here are working on it throughout the day. So when we work for 10 hours a day, this is what we are actually trying to achieve. So every staff that we use, and medicine is a very labor-intensive and capital-intensive program. So you want the best doctors, you want the best nurses, you want best administrators, and they come at a cost. Medicine is fast evolving. We just saw in the last session how much of digitalization is happening, how much of capital-intensive the new equipments are. And patient, when he comes in the hospital, he wants the best at the least cost. That has been the mentality. People think that doctors should not earn, hospitals should not earn. And with technology changing so fast and the investments that go into it, it is becoming extremely difficult. A lot of people, including government, private sector, private hospital, chains of hospitals are working on this. As I said, you want the best doctors, you want best equipment, you want best administrators to run it. There are several ways that we can cut the cost. And we did that during COVID time. All of us were hit by COVID and nobody knew how to handle these things. Government set up hospitals in 10 days. We changed very quickly. So there are 3 or 4 broad categories where we can work on. One is average length of stay. The concept of average length of stay was not very present in India. So when it is controlled by, say, government like NHS in UK, or the healthcare is controlled by insurance companies like in USA, people look at trying to minimize the admissions because that is the highest cost. So you try to do hip or knee replacements in 2 days. You do cholecystectomy, try to do it in 1 day, have day cares. So that is one area where we need to work on. Second is increase the productivity of your own staff. So as I said, all of us are very, very labor intensive. So how to get maximum work out of doctors, nurses in the given time? How to increase their productivity? So digital health in that sense will really help us on that. So there are several things that we do through the day, whether you are a doctor or a nurse. If that can be reduced or multiplied by taking care of wearables, AI, digitization of the health that the patient has, something like Health Aadhaar. Third thing that you can work on is looking at how to hire intelligent people who reduce a lot of cost. So if you have a good person in maintenance, a good engineer who can understand how to reduce the cost of water, conserve water, recycle it, lighting, a lot of things go west. People keep lights on, move from, say, standard lighting to LEDs, use intelligent lighting. So if the area is not getting used, how to use that. Using, again, electronic systems, you can optimize the beds. So how to reduce the time that is taken to fill up the beds, how to optimally utilize OTs, have insurance companies create packages which you can really work on. So there are several small things where you can work and reduce the cost.
Right. It's basically the optimally using your resources, be it manpower, be it your skilled workforce, be it your energy management, be it your financial resources, all about optimally using and taking best of the optimal usage for the outcome.
And add digital piece to it, which is currently not getting used.
No denying the fact. I'll come back to Dr. Patkar.
Yep.
Let's have a perspective from Mr. Muktesh Narula. Mr. Narula, your take on this, please.
We have industry leaders here. I am from a technology company. As far as costing is concerned, so we facilitate the communications between the doctors and the patients. That's one segment. And I can assure that we do it at the nominal cost. So
that's one part of you do it in nominal cost. But when you talk about the affordable healthcare, where do you see that the technology service providers can work with hospital administration or the government, all the healthcare ecosystem, to ensure that the technology is affordable and cost effective? What's your take on that?
yes, so like doctor said, to reduce the admissions for a longer duration. So what we facilitate is, the consultation over a communication channel instead of going to the hospital. So that's that way that we reduce the cost.
Right. I'll come back to you. Let's have a perspective from Dr. Kunal Punamiya. Mr. Punamiya, if I may ask you that, how much has telemedicine helped in making healthcare more affordable while not compromising on quality? Because there were apprehensions when, even before the session happening, there was apprehension about, okay, telemedicine has been embraced, but are patients ready or the doctors ready for telemedicine consultation? Because not everybody knows that when to consult for telemedicine or when to actually go to the hospitals, because we are habituated going to hospitals. But how do you think that things have changed in the last 2 years?
Over the last 2 years, telemedicine has been used very innovatively, and it's been more as a sense of requirement by the hospitals rather than the patients. Like it started from using telemedicine within the hospital. It started when you had your COVID wards and you had posted your resident doctors or some senior doctors who used to take rounds. You were trying to avoid others from getting exposed and tried to keep minimal the number of people who would go inside. A lot of telemedicine happened at that time through WhatsApp calls, video calls, probably having an iPad, and then actually fixing it, cameras, having those monitored trolleys who are giving you information about patients who are there in the wards, giving you data about patients and all. So it was something which came out of as a necessity. It was not seen as an innovation at that point of time that, I'm going to sell it in the market as it. Then next was that when your hospital beds were getting full because of the surge in the cases and we didn't have the required number of beds, Then we tried to segregate that, okay, those who do not require O2 support, can we manage them at home? While the doctors cannot really be present in the clinics, that is the time when we started doing telemedicine. Now, that type of telemedicine was the need of the hour. Shall we say that it's going to supplement healthcare entirely? I might not entirely agree with it. There is going to be some element of telemedicine involved, but one has to understand how and when to use it. Telemedicine is something wherein it can be more productive on follow-ups. It could be more productive while actually monitoring a patient after a certain procedure has done. He's gone back home and you want to make note of facts as to what's happening, rather than asking him to arrive at your clinic every time and again over some small some small things about some blood investigations, etc. That could be done on telemedicine. One could get a radiology investigation done in some particular center nearer to home, send it across through the PACS network of that center. They are able to put it on cloud, the doctor can review it. So you need to understand how you will use telemedicine. Is it going to obscure the OP requirement of the patient wherein he need not come to the hospital? No, that won't be, because at the end of it, at times, you have to actually see the patient. You need to actually palpate the patient, to examine the patient appropriately, all of which currently, I don't think most of us don't have that infrastructure in place. So it's going to evolve. But yes, telemedicine now, if you still use it for regular follow-ups, for some minor issues, to just check on patients, you can help reduce the cost of healthcare for the patient. At the same time, you will have more time for your doctors, for your nurses, to rather indulge in attending to patients who require your immediate care, rather than actually spending 15 minutes with a patient who's just come to see the reports. Reports can be emailed, I can review, and I can just have a conversation with you, and a prescription could be modified accordingly. So it's very necessary how you use telemedicine, and you should use it so that you can decrease the healthcare cost. At the same time, you will free up your time so that you can utilize it for the patients who actually require it.
Right, as Dr. Kunal is saying, that is all about, it all depends on how we are using telemedicine. Again, judiciously, optimally, if I may borrow what Dr. Patkar was saying in the beginning, that yes, telemedicine can solve a lot of problems when you talk about affordable healthcare, but at the same time, there will be moments when actually the patient needs to go to the hospital to see the doctor. But again, I think both the doctor and the patient has to decide when not to go to hospital and when to go for the tele consultation. That will again not only save cost, it will save time of the human resources as well. Let's have a perspective from Dr. Niraj Uttamani. Dr. Uttamani, do you think that a more evolved PPP model of partnership actually can help in expanding the scope of affordable healthcare, especially in a country like India?
Yeah, I fully agree. First and foremost, the real-time example we had with COVID, where there was a good PPP partnership with government on particular forums, on bed allotments, COVID testing, integrating COVID test to travel, everything it was integrated. In fact, this was the highest success of, I would say, this was a good time where we could test that India per se is now user savvy, and we are quite competent now in information technology. It is, in fact, it is thanks to the industry that has supported us to actually cater to this pandemic, which was otherwise a huge nightmare. The pandemic has supported us to understand one or two more things. In case of sudden surge, we again will have to bank on infrastructure related to IT backgrounds. We may require a different modification at a different time. We may require, but we now need to integrate properly. The healthcare has to integrate properly with IT. The systems have to evolve whereby each and every requirement is catered to well within time limits. So these are, I would also add one more thing here. If, we have been talking about quality and all, NABH system integration with IT is something which we are lacking, and we request the industry to look into it. If NABH can be integrated with IT and the deviations are picked up earlier, maybe those type of scenarios where we finally land up in some kind of disaster management, instead we are proactively preparing ourselves for this kind of scenarios.
Right, very important point raised by Dr. Niraj, whether we can integrate NABH with the digital technology, which will help in preempting a lot of things and which will result in solving a lot of problems. Unseen problems can be solved in that way. I'll just take a perspective from Mr. Muktesh. Mr. Muktesh, you just heard Dr. Niraj talking about the collaboration or partnership of healthcare service providers and hospitals and digitally connected ecosystem. Your thoughts on that how can it transform, or it is transforming the healthcare paradigm in a country like India, especially in the new normal?
So, information reaching to the people concerned at the right time is a big thing. I mean, we have all seen that during the pandemic, the information which was spread to the people, it really helped to take precautions, and the other things required for it. So I think that spreading of information is what we do well, and it's important.
Right. Spreading of information, correct information, and reaching out to the stakeholders is very important. Reaching out to the last mile is very important. I think during COVID, we have seen the kind of information which has been passed on from the city level to district level to village level to doctors to citizens. That has been remarkable, and how even the social media has been used. Again, the leveraging social media to provide with the correct information to the stakeholder. That stakeholders can be government, that can be hospitals, that can be industry, and end of that can be citizens. And because correct information reaching to the right people is very important. And again, technology has been a game changer in last few years in that. So we have talked about the affordability, the PPP model, optimal use of resources and everything. Let me come to the insurance aspect as well. So we have with us Dr. Sandeep Gore, Director of Emergency Medicine, Fortis Hospital, Mulund. Dr. Sandeep, if I may ask you that how much is the healthcare sector looking to optimally integrate with the health insurance providers to provide timely access to quality healthcare, because it's a very important issue. One thing is getting healthcare service, another thing is meeting the expense of that healthcare service, and insurance can save that. But what are the gaps and how those gaps can be filled to transform this kind of healthcare service providing vis-a-vis insurance?
Basically, our topic accessibility, affordability, and outcome of the patients. These all three topics are interrelated. What is the current status in India? The quality medical care, quality patient care is neither affordable and not accessible for the most of the segment. So this is the basic problem now. So what is our aim should be the affordability, accessibility, and the quality. That should be at the equal level. So that is our aim, and the insurance things. I think if we see the trend over the last decade, many people we can see they come to the tertiary healthcare center and they are insured. So insurance is the one thing that bring the big revaluation where common man also can get a great access to the quality emergency care, even at tertiary health care sector, at the corporate health sector also. So what we have to do is that we have to do the awareness in the public about the insurance. Means we should, means just like the, we can see everyone has a bike insurance, everyone has a car insurance, everyone has a home loan insurance, but they don't have insurance among the people. So everyone, this insurance should be the norm of the life. Because not everyone requires this medical care, but it should be just like a protocol. Every family should have insurance, so at that time they should get the quality care available at their doorsteps. So again, the 2018, our Niti Aayog has published one data. 6 crores people are getting pulled down to the below poverty line due to the healthcare expenditure which they do from the out of pocket. So that we have to prevent that things. So people, even suppose a corporate sector is available right in front of the home, but they can't afford, so they can't go there. So for that thing, the insurance should be the comprehensive. At the same time, we have to build accessibility. Now you go to the rural India, where some people may have money, they have everything, but they don't have accessibility of the healthcare. Suppose acute myocardial infarction happened at the taluka place, or acute stroke happened at the taluka place. They don't have accessibility. They have to travel to the city place, or they have to travel to the tier 2 or metro to get that particular thing. So we have to increase the accessibility also. So we are a country of 1.4 billions, and our problems are very big. Insurance is one of the thing we can do where affordable people are in metros. That will solve the problem of the people who are staying in the metros. But insurance will not solve the problem of the people who are living in the rural area where there is no proper health infrastructure or no clinical talent present at that place. So we require multidisciplinary approach to overcome this gap.
But Dr. Sandeep, taking cue from what you have said, you're basically talking about the urban-rural divide, right? But even in the urban areas, the amount of premium which has shot up, especially for elderly people. Remember, the health insurance is quite high, the premium what they're paying. Imagine a person who is 75 years old and who has retired 15 years back. If you go for a mediclaim, it's charging him 5 lakhs, 6 lakhs per annum. From where he'll give that money? So it's not about only urban-rural divide. The divide is very much there in the urban spectrum as well, and rural, it's there. But I think you have raised a very important part, that affordability and accessibility. If these two can be solved, and again, insurance is going to play a major factor in that. Let's have a perspective from Dr. Shreekant Sapatnekar. So your thoughts on this, on the insurance and the hospital ecosystem, providing quality healthcare at affordable price?
All together will not be possible. Let me not sound pessimistic. I come from Godrej Memorial Hospital. 80% of our patients are health insured. Hospital complaints, whenever I receive, 25% of the complaints are related to the bill. For the cash patients, non-insured patients, this 25% is gross, but for non-health insured people, it is 60 to 70%. Observe NABH standards, give quality care. Sir, mine is a consultant-based hospital, no full-timers, except CMOs, RMOs. So, consultants, they are in 5, 6 hospitals. To get them for any emergency, it's a hell. But, despite that, my complaints are minimum because Godrej spends through his trust. Non-COVID times sent large number of patients, 4 crores, and last year, 16 crores. During COVID time, it was fight that corporation says minimum, and you have charged me excess. There was Gherao, everything. All bills settled, and no complaint was, no merit was found in the complaint. But still, it is a headache. Despite spending 16 crore, this is the affair which my colleagues, their hospital is not private trust. Mine is a private trust. Godrej said if he feels 16 crores, 20 crores, whatever he spends, that is available. That's the reason. So I repeat, at the risk of not sounding pessimist, somebody has to pay. This is number one. Number two, digital technology wise, it has made excellent progress. COVID was precipitating factor. So many technologies were available right from 1998. Telemedicine has been available in Bombay, at least in the most rudimentary form. But COVID precipitated it. But it was the high case fatality rate. Now, case fatality rate is less. Today, this newspaper says it. There is epidemic, fourth wave or fifth wave, whichever it is. People have nothing to do with it. It was a crisis. We didn't know what is the nature of the disease. That united us. This is universal. Anytime there is a crisis, we unite. Once it is known, the glory, glamour goes away. We have to remember, digital technology, it has come fast. It was brake applied. Technology was available. It was not being used. It will be used. But now, subsequent progress will be, there will be 2 arrests, non-seriousness of the COVID. And second is the main danger. I will mention it, not elaborate on it. Consumer protection cases that act, day by day, the prices are, punishment awards are increasing. I know it. I'm a practicing lawyer also. Number 2, if you compromise with quality, what will happen if you are hit? Scare of being hit is so enormous. So, whomsoever you are advising, do this all together, it needs a brain. What do I tell my night duty CMO, who is not so well equipped? So, telemedicine, you had said, that report and not previous session, but report you missed something, or there is a claim that you missed, you didn't read the report properly, and there is penalty. Consultants can afford it. Their indemnity insurance is 75 lakhs. What about my full-timers? That is what I would submit humbly.
I can't stop myself from asking a question to you. As you've said, you talked about these 2-3 aspects. What is the way out, sir?
Way out, I told there has to be charity. For example, Global Hospital, they do so many transplants. There are poor people who can't afford. There is struggle. There are fundraisers, and fund is raised. To achieve all this together, there has to be someone. My problem is solved, Godrej Strategies spending. But others have to find resources. Otherwise, if it is not quality, your manpower will be exploited. Labor, 8 hourly duties. How many have 8 hourly duties? We are cutting corners there. Somewhere, you have to hit, and when it comes to hit, it is your employees. Or else you hire employees who are substandard and paying in terms of consumer protection.
See, there are various modes of financing. Again, crowdfunding, health insurances. Then there are various trusts. They are voluntarily coming forward. Especially we saw at Lilavati, we saw people coming forward to, help people. So at time of crisis, obviously funds come. there are various sources. Industries came forward. The, uh, the, the overall scenario was not as bad in terms of COVID. If you see other countries, India did fairly well. And thanks to all of us who were part in some or the other way. It was not only the COVID management. It was a management where, most of the industries came together to help the community. So funds are, I fully agree. Even we are a charitable institute. We are going with negative balance of charity. What we are supposed to do as per Charity Commissioner, we are at a negative balance of 4 to 5 crores. But that is part of the total scenario. You have to, in fact, you have to devise more means to develop funds and to, to subsidize patients who are less affording, to subsidize somewhere and probably hike up somewhere. So those sort of things are always there. So we need to understand where all we can cut down corners, where all we can cut down cost, and this cost consciousness may bring better healthcare for the community.
Cost consciousness resulting in better healthcare for our community. Interesting take by Dr. Sandeep Gore as well. I think we have come to the end of this discussion, but I can ask one question to all of you, one question to all of you. There's a lot of buzz around healthcare 4.0. Government is talking about that, industry is talking about that. You're representing the hospital ecosystem of the country. Do you think that health 4.0 is going to do what industry 4.0 has done for the manufacturing sector? That health 4.0 is going to help in ensuring affordable healthcare by reducing the cost, by leveraging emerging technologies and embracing technologies. So let me have a perspective from Dr. Deepak Patkar. Sir, your thoughts on that?
So it's going to be, according to me, it's going to be a great boon to the society, the entire 1.4 billion population. If we can make Aadhaar cards in a matter of 4 or 5 years and get the whole India connected, if you have Health Aadhaar, you have wearables. There's a conference in Harvard 3 years back where they said about 80% of the patients getting admitted today can be treated with wearables at home. So somebody who requires surgery and intensive care only needs to come to the hospital, get admitted. Everything else, the medical management can be done today by sitting at home with healthcare at home. If you do that, and government can do that along with private sector, dividing into primary care, secondary care, tertiary care, and quaternary care. If that can be done, a lot of cost can be saved. We have volumes. So if we can move on, say, mobile phone from 36 rupees per minute to free usage or 200 rupees per month, if we can do that as a country, I'm sure using technology and medicine together, we can reach much more than what is actually envisaged.
Right. Let me have a perspective from Dr. Kunal Punamiya. Dr. Kunal, your thoughts on that?
A population of 1.4 billion, where do you get more consumers than that for any industry? It all depends whether you have a product to cater to every cadre of the society. Healthcare has to be probably, most of our hospitals, most of us are coming from charitable hospitals, even a corporate hospital where Dr. Sandeep belongs, even they face the same challenges that we do. And at the end of it, all of us have the Robin Hood method of charging, where probably when a patient is going into a higher category, he's paying more, and you are subsidizing that cost, and they are actually subsidizing the cost for the people who are in the general ward. Today, insurance might cover a certain sect, but not everyone is insured. Even today in Mumbai, a lot of people do not have their own personal insurance. They have insurance that is covered from corporates. So there is a limit. which is at times not adequate. That limit in various corporates has not increased while healthcare cost has increased. So till the time people become self-aware, and yes, the insurance companies also, they have 1.4 billion consumers available to them. And what are they right now covering? Minuscule, negligible percentage. So you have to look at your market and you have to devise your product accordingly. As far as affordability is concerned, costs are rising for in every part of the, in each industry. Definitely healthcare costs are also increasing. When insurance comes with certain packages, what is the problem is that these are pure play administrators or MBA executives who never have probably worked in healthcare, understand intricacies of healthcare, but would like to put a price for healthcare. It cannot be a one-way thing. You need to have a collaboration, like there is an association like AHPI, which could be part of it. The government runs their own institutes. They would be knowing what is the cost of running a bed in the ward of the hospital, what is the cost of running a bed in an ICU of a government hospital. They would have an idea. Based on that, why not have that data? And why not share it with insurance companies along with healthcare players and do a collaborative way so that it's a win-win for all? Yes, insurance premiums are going to go up. If you see the world, we have been paying peanuts. Yes, it's going to go up. It's going to come as a shock in the beginning, but you will have to accept it over a period of time.
True.
But at the same time, let us also understand that these insurance companies are not only selling healthcare insurance, right? It's just one vertical. It's just one vertical. And like I say, my general ward is not the only ward that I'm catering to. It is just one ward. So like I say that in the general ward, I do charity. Probably they also do charity as far as healthcare is concerned. Because you don't have a fire every day. You don't have a theft every day. But you pay a high premium for all that. So there's a Robin Hood method of charging in everything. So please look at the consumer base you have and probably devise your market products based on that.
I really like that part when you said the Robin Hood method of deciding things. Thanks, Dr. Kunal, Punamiya, for your insights. Dr. Niraj Uttamani, your thoughts on that, please.
Well, there is a need of multi-sectoral thinking on this, and government should also be part of of all this discussion. This has to be a holistic approach. It can't be just insurance, just private hospitals, just government hospitals. There has to be some kind of a particular strata patient, if he is getting good quality treatment at a government hospital as well. So fine, the improvement in government sector is required. Then there is a middle level sector where the insurances and this and that. And as rightly said, that primary, secondary and tertiary care. Somebody rushing for fever to a multi-speciality tertiary care hospital, is it justifiable? Just because his affordability to pay is there, but it is not justifiable from medical point of view. The beds you are occupying for a non-critical patient can be comfortably utilized for critical patients. So we have to be judicious in all this. Now this would not come by just a few hospitals or association of hospitals talking. It has to be multi-sector. It has to come, there has to be representation from insurance, from government, from private sector, and there is a need of the hour that you have to integrate and come up with a proper planning method which is so evident in developed countries. Okay, fine, we have little less resources as compared to them, but let's use those resources in a differential manner so that we can give benefit to our community to the maximum extent. Thank you.
True, true. Let's have a perspective from Dr. Sandeep Gore as well.
I will talk little bit more as compared to all on this particular topic.
Yeah, sure.
Yeah. Because this health for all and healthcare for all is a very important mission. We are thinking going ahead with thing. In that thing, I had one meeting with Niti Aayog with Dr. VK Paul, also Dr. Kunal is aware about that particular meeting. The challenges as a country are very high. As you can see, we can build the technologies, we can build the infrastructure, we can build everything, but where you will bring the manpower for these things? And in India, the condition is like that 80 to 90% of population will seek the medical help only in emergency. Otherwise, nobody goes for routine checkup on, when accident happens, they will go seek the help. When chest pain happens, they will seek the medical help. When they experience some weakness of one side of body, they go and find out the care. They are looking for the emergency care. And emergency care, as compared to the Western country, as a developed country, we are far behind that. One study which is published in 2018, it's a central government as well as private government study, we have just 5% of emergency doctors available in this country as compared to the developed countries like UK, US and Canada. Generally what happens, why this is important? Now we have big hospitals, we have heart transplant, we have liver transplant. But many CEOs and medical directors are here. I am seeing that who can confidently say that they have world-class emergency department in their hospital. I think that is the one thing which that is the weakness of our healthcare system, because we don't have robust emergency care. How it affects the quality, affordability, and outcome, I will tell you now. Suppose what will happen, emergency, that is sometimes when they get to the emergency. Suppose one patient goes with the chest pain to the hospital. For them, hospital is emergency department. If proper chest pain evaluation happens, and if that chest pain have some 10 to 15 differential diagnoses, if it's simple costochondritis, that doctor can give analgesic and send that patient home. So the cost of care will be very less. But if that case is not properly diagnosed, and if it has gone for angiography and other things, so if that patient got directed to the wrong direction, that happens everywhere. So that cost will go very high. So simple, not all abdominal pain requires admission, not all fever patient admission, but all specialists will not be staying in a hospital 24/7. One specialty is there, that is emergency medicine specialty, which can tackle the emergencies of all super specialties and specialties, and that we have to empower. That if we empower, the Sapatnekar sold that midnight they have a doctor in emergency, and he said that he is not confident whether he can do these things. So if we place the confident person who can handle all type of emergency there, I think 90% of affordability and quality we can achieve with the simple step, because we lag behind as compared to the previous things. Now the last segment I will tell you about the quality of care. What comes with the quality? Quality, when we practice as per the standard, outcome will be very good. In stroke patient, if we get a thrombolysis within 3 minutes of arrival, outcome is going to be great. If acute myocardial infarction come to emergency department, if you diagnose properly and if you undergo angioplasty within 90 minutes of arrival, his outcome is bound to be good. So if we develop the robust emergency care across the country, not only the metros, it also in rural care, we can save many lives, we can avoid unnecessary admissions, and we can provide quality care, which will impact entire healthcare system. I think if we could do that, then only we could be able to achieve the Ayushman Bharat and other things which we plan to do for. Otherwise, it's impossible dream to pursue also.
Okay. Again, interesting perspective by Dr. Sandeep Gore. Let's have a perspective from Mr. Muktesh Narula as well. So your thoughts on India all poised for 4.0. Do you think that will solve many problems of India's healthcare ecosystem?
Yes, so I will agree with what the first doctor said, that wearables is something which is certainly going to solve the problem of accessibility to the remote areas. The patients there in any critical condition, they can be monitored very well through the variables and the data they transfer. So there certainly the technology is going to have.
You have got all the right to disagree also.
No,
if you have some other perspective, you can share.
No, since I have worked on it, I have read about it, so I am pretty confident that it's going to help.
So that's on a lighter note, I just said. Let's have a perspective from Dr. Shreekant Sapatnekar. So your thought on the future.
let us decide, are we talking of health or hospital? Ayushman Bharat, preventive, rural is one. We are experts, those who are sitting here are urban, NABH accredited hospitals. There is a vast difference between these. 1978, WHO had published a book by an author, very famous book, Where There Is No Doctor. In the morning, when the Assam example was given, I was wondering, which doctor is going to stay in Assam? Are we missionaries? Does the doctor not have a family? Let us not confuse ourselves. Let us not be wedded to idealistic conditions. Are we managing the hospitals, barring NABH, in the cities properly? Let us restrict to that. Health for all. By 2000 AD, I have been a professor of community medicine teaching the topic ad nauseam. But I realized people have their own choices. For example, ordinary, if you are going to a top grade hospital, what if it is convenient to him, if it is next door? He charges, if the charges are more, fine, he pays. That cross-subsidizes me. We are hospitals. Our clientele has been decided. Godrej Hospital, local people, they don't come. They don't feel it is a high-grade hospital. So, each hospital has by and large clientele which is either local or contacts with that consultant. It is not that come one, come all. Let us not fool ourselves. With reputation, people, they do come from far and wide, and a hospital, once it has developed a reputation, people fall in. Once the hospital bed occupancy is more than 200, it is affordable. Little cross-subsidy or Robin Hood principle. That way, there is a laxity. Either that or else donations. Donations, insurance is one. Private trust, of course, Godrej is an exception. But corporate social responsibility, rather than spending merely on gardens or some purpose which is hidden, if there is corporate social responsibility mandating that government is allocating so much, let part of the corporate social responsibility go to that hospital. These are the ways. I'm basically harping on an issue that all those four elements which have been said there and affordable, it is not possible. My humble submission.
Thanks for your insights, Dr. Sapatnekar. Hearing you, I think I'll say it's a position like to be or not to be. But thank you so much. I think this has really been an exciting panel discussion where divergent views has come. And that was a motto that when we were planning this session, that let all of you leaders come together and express your opinion on what are your thoughts on ensuring affordable, accessible healthcare, and how can actually we realize the vision of health for all. And I think deliberations made in this session actually guide us all the stakeholders of the healthcare ecosystem to move into the right direction in future. At the end, I can just only say that if you just take example of, before taking the example, I might refer to what Dr. Deepak Patkar was saying, or Dr. Kunal Punamiya was saying, the Robin Hood philosophy or collaborative approach for an optimal use of resources, as you all have supported that. Let's take the example of COVID. what kind of wonders it has done. In a country like India, when we have vaccinated more than 100 crore people already, and again, there was no urban-rural divide. Even a rural person who is staying in the district or the villages, he had his name registered in the COVID app by himself or some other, so that he can go for the vaccination and see that again the technological integration happened in COVID app, COVID website is remarkable, which is now a case study globally. So I think, as you all have said, that if we have a collaborative approach, we have the intention to solve problem. I think in a country like India, as Dr. Kunal was saying, the population, think about the population, and that will define the market size, what we can do. If we can take the population as a opportunity, but not as a challenge, I think brighter days are ahead for India as a nation and India's healthcare growth story. Thank you so much, all of you, for joining us for this panel discussion. Let's have a big round of applause for all of them. Dr. Deepak Patkar, Muktesh Narula, Dr. Kunal Punamiya, Dr. Niraj Uttamani, Dr. Sandeep Gore, Dr. Shreekant Sapatnekar. Thank you so much, all of you. I request Mr. Rajneesh De, consulting editor of APAC News Network, to come on stage and hand over the souvenirs to all our esteemed speakers. Thank you so much for shedding some light on the very important issues of affordability and accessibility of healthcare. We can start with Dr. Deepak Patkar, Director of Medical Services and Head Department of Imaging, Nanavati Max Super Speciality Hospital. A huge round of applause for him, please. To Dr. Kunal Punamiya, CEO SL Raheja Hospital of Fortis Associate. To Dr. Sandeep Gore, Director Emergency Medicine Fortis Hospital. To Dr. Niraj Uttamani, Medical Superintendent Lilavati Hospital Research Center. To Dr. Shreekant Sapatnekar, Medical Director Godrej Memorial Hospital. And to Mr. Muktesh Narula, Associate Director, Pinnacle Teleservices Private Limited. Can we have a group photo of all the speakers together with their souvenirs in the hand, please? Yeah, you can come front. So these are the healthcare and hospital ecosystem leaders from of the country who has shed some light and given insights on the affordable and accessible healthcare in a country like India. Thank you, all of you. Thank you so much. With this, we move to the last session of the day of the prestigious 5th edition of APAC. Thank you. HealthTech Innovation Conclave being organized by APAC News Network, and I'd like to thank our partners. Dell Technologies and Intel presents this conference. Our gold partners, Newman, Citrix Associate Partners, Muruta and Neos and Pinnacle as well. I request Mr. Rajneesh De to come on stage and start the next session. Over to you, Mr. Rajneesh De.